Hello Classic Crew, and welcome to today's video where we're going to be sharing our birth story. I hope you guys have coffee. We're both drinking coffee. It's early in the morning. Little man is sitting over here off to the side. He was supposed to be napping, but he woke up a little too soon, so he's gonna be participating. If you hear any baby sounds, that's what that is.
He's highly distracting.
I mean, because he's so cute.
Because he's too cute?
He's too cute.
He's too cute.
So in today's video, we want to share our birth story. I have been wanting to share this with you guys for a while, but it's been taking some time for us to get in the swing of things and find the time.
Because the fourth trimester is time intensive.
Oh my gosh, the fourth trimester is real. We just passed out of it. He's 13 weeks. Oh, he's yawning, he's so cute. And, and so now that we're kind of past that, I feel like we're getting into the swing of things, and it's awesome.
Well, we and he are getting into the swing of things. Because now he's better at, life.
Being a person.
Yeah, being alive. Such that he can eat regularly and effectively and sleep more regularly, more effectively.
He did great today.
Yeah.
Yeah. So we are really excited to share our birth story. I'm also going to be doing a little bit of a birth class review. So we did a birth class called Copa Birth with the intention of doing a natural labor. And I wanted to review it for you guys. If you are interested in trying to attempt a natural labor, you can decide if that class might work for you. It's a little more affordable than a lot of other options, and it's all online, so you can do it at your own pace, which I really liked. So I think to begin the story, we have to start about a week before I went into labor. So I went in for my doctor's appointment. You were able to come, and they did fetal monitoring to see if the baby was doing well. And in that fetal monitoring, I found out that I was contracting slightly, but regularly, and I wasn't really feeling it. And
I'm just going to be staring off into the corner as far as y'all are concerned because he's dancing, and that's going to be my default eye position, so that's why that is what it is.
Because he's so cute.
He is.
So I also got a cervical check at that appointment to see how far along I was, and I believe I was 2 centimeters dilated and 50% effaced at that appointment. But because of the cervical check, I started contracting, and I was contracting every night for about a week, to the point where I legitimately thought I was in labor a number of times and wasn't sure. And so,
including, so at the beginning of that week, we had gone to see The Batman, the Robert Pattinson one. Not that any other one would be in theaters. And we thought that you might be going into labor during the movie.
Yes.
And that would have made it complicated for us, raising our son, because he would have been into geek culture, which wouldn't be worth it. No. And we might have to name him Robert or something, and it'd just be all too complicated. He might be emo and goth.
Terrible.
Yeah.
When we went in for the next week's appointment, I had progressed a little bit, and what cervical dilation and effacement mean is dilation is the opening and effacement is thinning. So the opening getting bigger and the cervix getting thinner. So the next day after that appointment,
Don't mind me.
My legs were pretty swollen. So I will say I had pretty swollen ankles throughout the pregnancy, but that night, I specifically remember my ankles getting more swollen, and I turned to you and I said, do you remember this? I asked you to massage my ankles a little bit to get some of the water retention out because my ankles were so swollen.
I remember that you did that. I don't remember the timing.
Yeah, it was the night before I went into labor.
Oh.
And
That's what did it?
Well, we were also doing these videos on YouTube, which I will try and link. I have to find them and link them in this video because I think that helped to get labor started.
So, a little bit of mental context for us, right? So this is the leading up to us, to Abigail giving birth, is that the week before we had all these, false positive, contractions, it could happen. So we were in the frame a week later of, oh my God, can it happen already?
Right.
Just let the shoe drop, And so Abigail had looked up these videos, exercises on YouTube, go figure, of how to try and get labor to actually happen once you're at the final endpoint. So we did those, and then a day or two later, lo and behold, Abby does start to give birth.
Yeah. So I don't know if I've told you this, but I actually had a feeling the night
revelations.
before. I had a feeling the night before I went into labor that I was going to go into labor the next day. But because I'd been kind of thinking every night that I was going into labor, I didn't want to like say to you, I think I'm going to go into labor tonight. So I didn't mention it.
A little dash of Abby hypochondria.
Well, yeah, I didn't want it to be the boy who cried wolf again. So I was like, you know what? I won't say anything. But I remember I was taking a shower that night, and I was like, I got a feeling something's about to happen.
Mm-hmm.
So I woke up in the morning at about 5:45 and went to the bathroom, came back in bed, and was contracting. And I woke you up. I'm trying
to remember if it was like, I think it was closer to like 5 a.m.
Maybe it was 5 a.m.
It was like 4:50.
Yeah.
Yeah. What I remember it being is, because you getting up out of bed wouldn't have woken me up.
No.
I remember being woken up by you saying, I think I'm like going
I think I'm in labor.
Or I think I'm having the baby, and then then your water broke.
Yeah. So I was contracting for a little while, and I didn't want to wake Jacob up until I was pretty certain that they were coming consistently. And so that only took about 20 minutes for me to confirm. And when I turned over to Jacob and said, I think I'm going into labor, my water broke immediately.
Are you sure? Oh, yeah, we're sure.
Right, exactly. And for those who are curious, when your water breaks, people will say, oh, it feels like you're peeing. It doesn't feel like that. It just feels like all of a sudden there's like water. You wouldn't get confused. In my experience, I wasn't confused with the two feelings. And so I said that we figured out that this was going on. So you pulled out the contraction timer, mm-hmm. and we started timing the contractions, and we did that for an hour. Because when you call the doctor, you're supposed to have tracked the timing of the contractions for an hour to see if they're consistent and to see if they last a good amount of time. So they're supposed to be like within 5 minutes of each other, and each contraction is supposed to last a minute.
Yes.
So that was going on.
It's the so-called 5-1-1.
Yes, exactly. Which, do you want to explain what that is?
You have contractions 5 minutes apart or more rapidly. They last 1 minute, and this persists for an hour.
Yes, exactly. And so that was what was happening.
It'd be real embarrassing if we were both wrong about it in the same way, and then, whatever, the comments will correct us.
Yeah, exactly. So it was, that's what was going on. The idea of labor, as we had learned in our COPA birth class, which I will say, we give a positive review. We really liked it. She did a really great job teaching it.
Spoilers for the review that's going to happen within several minutes from now? Oh, my God.
I don't know. Well, I don't know how. I feel like it's just going to come in and out of play rather than being like a review at the end.
You will see as we discuss the labor and the delivery and the things like that, whatever faculty of knowledge we have with this process is primarily from COPA birth, entirely from COPA birth on my end, but Abigail has always had an interest in conception and pregnancy and delivery, mm-hmm. and so she had background knowledge, but a lot of the more intimate details of it and the practical side, that's all from COPA birth, and so we're very favorably disposed towards it. There are a few kinks, but nothing that should dissuade you from buying it. It's just suggestions like you would have for anything for how it could be improved. Yeah, but I would recommend it if you were looking for a natural labor class. Yeah. I thought it was really easy to follow. I really liked the woman who was leading it. She was very friendly. It's hers. She's the entrepreneur. So mm-hmm. she's the presenter. She is your source of knowledge, and she's the entrepreneur behind it. Good for her wearing that many crowns all at once. And a mother of 5? I think she's either 5 or 6. Yes. Which is really cool. She produced her videos while pregnant with the 5th. I think it was the 5th, yeah. But just a very calm-voiced, nice, approachable woman. And doesn't make you feel guilty if things don't go the natural labor route. Yes, she has a very good term that she uses for like her mentality, which is trying to have a low intervention birth, not no intervention. So she's not ideologically anti-medical intervention. You can't do this no matter what, or only, break glass in case of emergency. That's the only time that you're going to be using an epidural or medical intervention. Instead, it's women have a default ability to do this natural side, but life is complicated, and so things can arise that make it relevant for you to have medical interventions. Here's the knowledge base to know how to do things naturally, and to know when medical intervention is relevant, and to know what scale of medical intervention is relevant, and when and how, so that you can do things in the most effective and least intervening, but intervening if necessary, way possible.
And
which is great.
also
That's the right mentality as far as we're concerned.
Right. And her class, I will also say, is more geared towards someone who wants to have a low intervention labor at a hospital.
Yes.
Which was something that I would only be comfortable doing.
It's not really a home birth kind of thing.
No. So with that in mind, we called the doctor and on the morning that I went into labor, and my doctors were not on call that weekend. So we actually ended up getting set up with a different doctor who we loved. She was amazing.
She was a complete pro.
Awesome.
So our doctor, very nice guy, competent, all those things, but there's a real big difference, and our doctor's in his late 30s, early 40s, something like that.
I would say like 40s.
Yeah, it's hard to tell. He's got very smooth skin. But the woman who was on call was in her 60s, and she is, I hate that internet phrase, X person is just built different, or like, they were just built different back in the day.
Yeah.
But to adopt that phrase that I hate, so, really I should hate myself. This woman is of that medical generation that's just built different.
Yeah.
Like just absolute mix of the right kind of intensity, but also really doting bedside manner.
Yeah,
and
she
I
was
feel like
fantastic.
a lot of younger doctors, like Gen X doctors or millennial doctors, it's like you either get clinical, sterile, no bedside manner, or you get basically a hippie,
right,
who wants to be your friend.
They like
and is
haven't
super
figured
calm.
out the balance yet. But she was
authority and also warmth. And
Yes.
this woman, absolute pro.
And the thing that I thought was really cool about her was that she also didn't like baby you. She treated you like, you're gonna do this, you're gonna be great. I just loved it. It was very inspirational to me. I was like, okay, let's do it. So when we called that morning, and you told her that my water had broken and that my contractions were coming regularly, she just said, go to the hospital right away and skip triage, just go to the birthing room, which is the best.
And she called ahead to set us up for that.
Exactly. And having to go in to a triage room is just kind of annoying. So that was really awesome, was that we were able to do that. So we went straight to the hospital. I mean, we packed up. I did not have early labor of like, oh, I think I'm contracting. This is slow. And then it builds and builds and builds.
Which can be a multi-hour stage
Yes.
of labor, is this early one. Hey, and I was so
We were
excited
prepared.
for earlier. We could play some video games.
We're gonna
we could
watch
some
movies.
shows. I have everything in the world to try and lightly distract you, and you're like,
Right.
oh,
Yeah, it's like you're supposed to
beginning.
start with distraction. I woke up and was immediately in active labor. Like, I'm in pain. This is intense.
It was moderate pain compared to what came later.
Oh, yeah.
It was moderate pain. Like, she could function. It was like, give me a second. Okay, as you were saying, kind of like if you were getting flashes of headache, but they weren't like roosting.
Yeah.
Yeah.
So I would say it was like probably a four on this pain level to start.
Really? To start?
Yes.
Wow.
Well, because I
okay.
couldn't. Because the thing they always say is if you can't talk through your contractions, then they're.
Yes,
and I
you-
couldn't talk through
you
my
could
contractions.
not. Compared to what came later, and this is the fun part of Abby's labor story.
Yeah.
Yeah.
So-
let's continue.
So we get to the hospital after having packed up my hospital bag and Jacob's bags, and we pull in. We get put into the room. I ask for a nurse that can work with somebody who's doing a natural labor. We brought a birth preference rather than a birth plan. That was something that was recommended in the birth class, which was really smart. Everyone really liked that it said birth preference on top.
Yes, everyone.
People
liked
really
that.
appreciated that.
We had our preferences, but did not have like an ideological predisposition of I will not work with you if you do not accede to my demands.
Right.
Is not the approach that we took.
No, and so we met the doctor. I came in so we got into the hospital probably around 8:30.
Yeah.
The doctor came in and introduced herself, and what I really appreciated was that we told her we were trying to do a natural labor, and she basically said, I totally respect that, and if that's what you want to do, that's great, but don't blame yourself if you have to get an epidural. Epidurals are also really positive and can be really helpful. And the two things that she said that gave me some perspective was it can be easier on the baby because as the mom, you're not holding your breath, you're not straining, you're not stressed because you're not in as much pain. And the baby can handle that a little bit better if you're not the one struggling. And number two, it puts you more in control, which seems like it would be the antithesis of what's going on, but you're more clear-headed, so you can make better decisions and better choices.
Yeah.
And when she said that, it just allowed me to say, okay, if this becomes necessary, I don't have to blame myself, which it did become necessary.
Yeah.
So what ended up happening is that what was it, 4 centimeters? I think I must have not, I know I was progressing regularly, so I probably was at 3 centimeters when we got there, because by 4 centimeters, I was in extreme
Yeah, so I'll take over this section of the story here.
The camera briefly died, but we are back.
So we get to the hospital at about 8:30. We get through all the administrative stuff. We're in the room by about 9:15, 9:30. And then, things are happening pretty much at the same pace. Abby has the kind of contractions that make her go, oh. Mm-hmm. And then continue. And that's about 3 centimeters dilated, up to about 4 centimeters dilated. And then around 11... this is like the labor really begins because Abby is really starting to be in pain, and her pain is intense. And so Abby's pain is like blinding, and she's concerned. She's like sweating. I don't think I could do this. I don't think I could do this. And
we were trying different positions. I was trying all of the breathing techniques and all of that.
We wanted to do the natural labor because we had our concerns about the epidural, as I was mentioning before. And so it's around this time period, maybe 11:30, that our doctor comes in, seeing Abby's reaction and noting that it was off in the sense of it shouldn't be this much this early. And she checked Abby's, the hand gesture's a bit much, but you can leave it in. She checked Abigail's effacement and dilation and noted that she was only at about 5 centimeters, and Abby was in screaming pain from the very check itself, and then also from the contractions. And the doctor again was noting that's...
To be clear, I didn't actually scream, I don't think. I think I was like, but I didn't
well, to me, sorry, that to me is screaming. Okay. Abigail was not doing blood-curdling shrieks,
no.
But
I was moaning and...
That's not what it was,
yeah.
but ow, 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 ow. To me, that's screaming pain.
Fair enough.
Fine. Shouting pain. But she was noting that you should not be in that kind of pain just from the mere fact of me checking you. That's off, and we'll come to that later in the story. But yeah, Abby was in blinding pain, and the level of pain, they have that idiotic pain chart, 0 to 10. How could you possibly rate your pain? Try. It seemed from our estimates that, and the doctor as well, that the level of pain Abigail was in was the level of pain you would experience in so-called transition. As the baby descends from up in the womb through that, and they're called stations, the level the baby would be in, so that the baby is actually primed to then start to pass through and be born. That's when the real pain begins.
Yeah, it's between 7 and 10 centimeters.
Yeah.
So I was at 4.
She was at 4 and experiencing that equivalent level of pain. That's the birth video pain that you may have seen in health class or in real life if you've had your children already. But that was so off and so strange. And this is regrettable to say, I didn't know if Abigail was being a baby about it or not. And if Abby was just overreacting to an expectable level of pain that's what women normally experience, or is it worth it for you to get the epidural just on this basis? Because we really wanted to do that in natural birth. And no one had encouraged that in us. We're not... It was
my own thing.
It was Abby's own thing. Her mom was like, you don't get a medal for doing it like this. The doctor, of a very similar disposition, kind of temperament to your mom, basically had the same turn of phrase.
Yes.
We don't, there are certain elements of, the female YouTuber world where, that actually would be something you get a medal for.
Right.
Right? More of the trad world and stuff like that. That's not what we are. That's not what Abby is. She has her own video and content out there about trad versus classic. We're not people who are trying to shun modernity in that way and needed to have home birth, that stuff. Some people approach it that way. That's not us.
No, it was just me trying it. I wanted to see if I could. And
she had emphasized to me, don't let me take the epidural frivolously, right?
Yes,
so
and I said,
I'm trying to be her advocate here. I'm trying to be her counsel here, her attorney. No. So I'm trying to talk it out with her while she's in this blinding pain. Are you being a baby, or are you, or like you
is this
actually in
real,
pain?
or what's going on? And I was like, I need the epidural. And they brought the epidural in. The doctor did it in like 2 seconds. It was amazing.
Yeah, it was very quick, but Abby was in the kind of pain that she had to like bend over so that they could access her spine to give the epidural.
Yeah.
And even that shift in position, because it wasn't the optimal position, Abby was like in blind pain.
Yeah, it was not great. And I remember thinking, I wanted to try and describe the pain of a contraction, and I think the best way I can remember it, because your brain really does wipe it away, which is amazing, is it's not like super sharp. It's like, imagine a dull pain, that like throbbing, but it's hard to imagine it being super amped up, but it's like that amped up to the highest degree. I don't know. That was not what I was expecting necessarily, and that's what it felt like. So they gave me the epidural, and it did lessen the pain, but it was not, it went from like an 11 to a 6, I would say. I was still in pain.
Yeah, no, you were still in quite a bit of pain. So, this is about 1 p.m. To give you the time codes again.
Yes.
And so she's still in quite a great deal of pain, and she starts to progress. She starts to dilate more and more. And then she gets up to, like 8, 9?
Yeah,
8, 9, pretty quickly after that. And so the pain ramps up, and so she's back to that same level of pain that she was
like
in.
Like 9 again.
When she first got the epidural. So we were like debating it, and she was going to get a second dose of the epidural. My terms might be a little bit off here. But we were concerned about it being too much, and she wouldn't be able to feel anything. So first she got like 60% of the second dose, and it was not working enough. And so she got the other 40%. And even with a second full dose of epidural, she still, by the time that she was like delivering our boy, in like that full level of pain that she was experiencing before. It was crazy.
Yeah.
And
so, I pushed for 2.5 hours.
Yes, she pushed for 2.5 hours. So he was born at about
4:54.
Yeah, I was gonna say 4:50 for precision. So he was born about 5
Which is
p.m.
exactly 12 hours, pretty much, from when I started going into labor.
Yeah.
And he, the reason I had to push for so long was that his head was like this, and a baby's head when it's being born should be like this.
Well,
should be down. By the way,
yeah.
It was a spider. Spider. He was turned. He was sunny side up inside, but he did rotate as he was coming out.
He was rotated.
No. You're getting confused.
I'm getting confused.
So he was he rotated his whole body as he was coming out, so that he was born the correct way. He was born anterior, but his head position. What I'm talking about is his head position. A baby's head position.
Oh, his neck flexion or
his
extension.
neck was flexed like this as he was coming out of the birth canal. Because of that, my doctor had to reach inside of me and pull his head down. And what she told me...
That's what that was for,
That's what that was for. And she said to us afterward, had you not had an epidural, you would have had a C-section. Because I would not have been able to reach inside of you and pull his head down.
Because the pain would have been too blinding based upon everything else indicated by the cervical checks or every other kind of manual inspection that the doctor needed to perform throughout the process.
But it also, like, I think even if I didn't have the problem I had, which we will explain now, it would be hard to reach inside of a woman giving birth without medication.
I don't know about
but
that.
I think.
Yeah.
So the reason that I was in so much pain was because I had decided I wanted to try to do something called perennial massage, which is to basically stretch out the area in advance of labor and get it prepared so that it will stretch easily during
the
labor.
Area, not stretch out. Because stretch out implies that
it won't bounce back.
Yeah, elasticity as well.
So just keeping it stretched and keeping it like soft and elastic is the idea. So that when you're in labor, that area will stretch evenly and you won't have tearing.
some people counsel perineal massage so that the area can more naturally stretch and it will not either tear nor be so strained that an episiotomy would be relevant, which ideally, right? Oh, if that works, it'd be nice. You avoid a tear or avoid the need for what amounts to a medical tear, medical cut on it, and everyone's happy and you just had to do a little massage. But not everyone was happy because it's not that easy in our case, and this was the source of our pain.
So
her pain.
What ended up being the case was that I had tears prior to even starting labor. I had internal tearing
Because
I had attempted
of the
this.
attempted perineal massage.
And that meant that all of my contractions from the beginning were very painful because I had internal tearing. Now, internal tearing happens during labor, but it usually doesn't happen until later in the process when you're actually getting, your body is stretching so that the baby can come out. And you usually have them also during the pushing stage. I had them from the first moment
from before
of labor.
any of this began because they occurred like a week or two in advance of the labor. And so when Abby had done the perineal massage, she's like, oh, this hurts a bit, huh? And we thought, that's just the way it goes. Whoever has done a massage/stretch on this region of the body before, like that's not a thing that occurs in daily life. So yeah, okay, some pain along the way that's like mild, but there, and then nothing was felt afterwards, right? It's not like it was lingering, not as if you had felt or noticed a tear. It was just, happened at the time that pressure was applied. Oh, okay, I guess that's part of the territory.
So when he was born,
not in fact.
Yeah, it was not. And so when he was born, I had the spider's back.
Oh,
and
he is doing an ambush very slowly.
So that's why I was in so much pain, and thank God for the epidural in many, many ways. I'm very grateful for it. I was able to deliver him vaginally, which is great. But he came out, and they put him on my chest, and I was just in such pain that I really couldn't take that moment in. And I remember just saying can someone give me something? So they ended up giving me another epidural. So they gave me an epidural to do the stitches.
Oh, I didn't even know about that because I was focused on the baby.
Yes, at that point, Jacob was in it with the baby, and I was in it with the stitches because
He was gray.
He was adorable.
I thought babies I knew that they were not a normal flesh tone when they come out. I just didn't realize gray specifically.
Yeah, which is a little scary looking.
Yeah. Well, he wasn't moving the exact second he came out. He started to move a few seconds after, and so I was petrified when that happened.
Yeah.
To take a step back.
But they knew he was fine because he did great throughout the entire labor. His heart rate never dropped even a beat. He was doing wonderfully throughout, which was really comforting for us.
Oh, so I guess this is a little bit out of order, but I want to describe my involvement.
No, I want you to. So one thing I will say is that the epidural did take more on one side of my body than the other. Mm-hmm. So my left leg was entirely numb. I really couldn't move it, and my right leg was entirely numb. But my left leg was still feeling in it. So now you can say what your involvement was, and then let's push it so I can feed this boy.
Yes. So just throughout the labor, especially as it became not just active, but really the intense stages from the epidural and post 1 p.m. on, as Abby was really pushing, her right side of her body was just dead, and so the nurses were wonderful. The staff at the hospital was just absolutely fantastic and professional. Also, a very nice facility, but I was in it to win it, and so I was putting the ice pack on her head. I was lifting her right leg and putting it into the stirrup each time that she was going to be doing a bout of pushing, and I was the one who, from the doctor's instructions,
you were amazing.
Was counting down and giving the push, time, push, keep pushing, and the doctor gave pretty nuanced instructions for the manner in which her physical effort was to be made. You know, don't push like in your head, push down in your body, don't like tense up here in this way and hold your breath in this aspect, but like keep the muscle movement going. So I was helping to coach with that, and not in like a stupid make work way, like a union job, like, oh, you know, we need someone to plug in the lights, and no one's allowed to plug in the lights except Dad, because that's Dad's job. Oh, see, he gets a role. No, I was quite involved. So yeah, I was responsible for that right leg, the ice pack, the coaching.
You were so wonderful. I was so grateful you were there. You really helped me.
I thought I would be squeamish about it all, and I was very much
They
not.
brought in a mirror, and we watched, and Jacob was like, wow!
It wasn't the mirror. The mirror was at my insistence for you, because I had the right leg, and it was like, oh, I could see it. Oh, it's happening! Because it was taking, not forever, but it was taking hours, and you were in so much pain, so I was like, so what's happening here? Is it moving? Like, and yes, it was moving, in fact, and that is the very beginnings of the top of a child's head arriving.
Which is so crazy.
And so I was so enthusiastic and happy about that. So I asked that the mirror be wheeled over so that Abby could see, to encourage her, like, see, you're doing the work. It's working. It helped, and then it became like unnecessary.
No, I said,
for you to continue
exactly.
to see.
I said,
okay,
it's good for me to know that it's there and I can see his head and know he's coming out, but I can't see myself pushing because the visual of myself like tearing and stuff like that, like that was hard to swallow.
Yeah.
But he was born, he was healthy. They sewed me up for an hour and a half.
Yes.
Which meant I didn't really get to hold him for the first hour and a half.
Because of the tears that were exacerbated by the, physical trauma of delivering a baby on top of the tears.
So I got to hold him immediately after, but then I didn't get to hold him again until they were done with the stitches because they wanted to make sure that, if I was in pain or something, I wouldn't drop him.
Yeah.
And then he was
I got
born.
to see the placenta.
You did get to see the placenta.
And my best description of a placenta, it's like, I really thought I was going to be just completely about all of the, in Andrew Klavan's terms, the gore of pregnancy, which I like that term. And he said of himself in his autobiography, he was just completely immersed in the gore of pregnancy in the sense of he was in it, he was massively participatory. And the same thing for me, and that it was not the case that I or anyone else would have thought that would be the way I'd be in advance. So I don't know, it was very special. But a placenta is wild, man. It looks like if you combined a liver, like beef liver, with a jellyfish.
Yeah, it's really crazy looking. They showed us, it was really cool.
With a 6'3" Ukrainian woman doctor who was a very thick accent, who was super, nurse, who was super nice. And she's like, you want to see it? I'm like, yeah, sure. It's like, you'd think I'd have a better Eastern European accent to be able to do after being a Russian major, but nah.
But what's really amazing about the whole story, because, 12 hours from beginning to end, and I would say, so what I want to say that's funny about it is that right after it happened, I was like, oh my God, that was horrifying. But looking back on it, even within a couple of days, I was like, first of all, I was very lucky overall, really, really lucky. The epidural was helpful, and it was a very quick labor, and he came out healthy. And I really didn't have any problems recovering afterwards.
Yeah. So they gave you an estimated time of 8 weeks.
Because of all the tearing, yeah.
Yeah. Normally it's 6 weeks is the recommendation, or so we were told. 8 weeks is what Abigail was given because of all the stitch work that had to be done. But her recovery was absolutely on pace and occurred 100%. So
yeah, even 4 or 5 days after he was born, I was taking walks.
Yeah.
But the thing about it is that labor is hard, but it's not. I think that what's important to remember is your hormones in your brain erase how hard it was, but B, it's so short.
They faded.
In a lot of ways, it's erased. I feel like I don't even remember, and I'm like, yeah, I could do that again. I could do that 5 more times.
Yeah,
if you had asked me the next
That
day.
was a few weeks later, and the handful of weeks right after, it had started to fade a little bit, but it was very present for you. And then by now, apparently it's
I'm just gonna do this again.
Yeah,
it's fine.
Well, we had resolved on that, but now it's without any sense of physical hesitation.
And it does. It's you're fine. It's it's gonna be okay, and your body knows what it's doing, and the doctors are there to help you, thank God. And I'm probably going to get an epidural. And the spider is back on the thing. So we're
Yeah,
good.
he's retreated. he didn't want these hands.
But I was going to say something else about labor, which is just that it's very short. And that's the thing to remember. It's like you can do anything for just that short amount of time.
There's a great Tolstoy short story called "How Much Land Does a Man Need?" And there's just a little phrase in it that the main character, it's like a parable, it's not meant to be positive, but he says, like a moment's pain for a lifetime's gain. He says that while like mowing or doing something with land to acquire massive amounts of acreage, and then he dies of a heart attack while doing it. So he's not a positive example, but it's like a weird crypto socialist anarchist Tolstoy short story towards the end of his life. So
Right.
Okay, fair enough. But just that phrase, a moment's pain for a lifetime's gain, I think I said something to that effect to you during the process because I like the turn of phrase.
And it's true. And you get this amazing human, which is like the best thing ever.
It is the single most important thing that you will ever do is have children. And I don't need counterexamples from anyone who's saying, oh, X person didn't have kids and they did an amazing world change. No, stop being pedantic. The most important thing a person will do is have a child. And I mean, what will you ever do for any other person that could possibly be as your father's gonna cringe, impactful and important to them as your role as parent to a child? Like if you want to serve others, if you want to be like a nice person and do good things for other people, raise a happy, healthy child who can love the world and is capable of doing good things and be strong and sovereign and do nice things for themselves and others. Like that's the greatest act of love and devotion to man that you can have, and it is absolutely world changing. I like to say that time did not exist. Aside from the stuff I was saying earlier about time did not exist before we had a child, in the sense of now time exists in that there's no pausing your role with a child, right? It's not like, oh, okay, I can't really be a parent for you in some relevant way and do what you need
7 days a week.
in this section of your life, right? Like 0 to 6 months of your life. Listen, I'm not in a good position to be doing that right now. No, you have to be immersed all the time doing it. Time exists. Whereas prior to having a child or that kind of responsibility, time doesn't exist. You live in an eternal present. Career, okay, but you could have a new career, you could start a new job, whatever. Like your life can stop and start in any direction, in any way, then, and you can faff about for decades even. But once you have a child, your moral responsibility to that child never has an off day.
Yeah.
And so just time keeps marching on, and you can't pause any moment in their life to appreciate it more. So newborn stage, be there for it or you don't get it.
Yeah. Although I will say, don't be hard on yourself, especially with a first child, because I'm realizing now that like going into my next child, things might be different. But don't be hard on yourself if you don't like the newborn stage. The newborn stage is so hard and you are so exhausted. The photos in your mind of newborns of like, oh, it's like a puppy, or like, oh, it's like a baby. It's so cute. It is really cute in those little snapshots of your mind, but the day-to-day of taking care of a newborn is really overwhelming when you've never done it before and when you don't know yet that it has an endpoint.
Yeah.
And when you've had a child before, I assume with your next child, I've heard from other mothers that your next child, you're like, oh, I can get through this because I know that it's going to get easier. Mm-hmm. But with a first child, you're like, no, this is just it. Like, it's just going to be like this forever.
The comparison that we used earlier on as we're going through the stage to like have perspective is, like teenagers aren't experiencing greater heartbreak than people who are actually full grown and having real relationships. It's just that teenagers have no sense of scale or proportion or experience with any of the stuff that they experience. And so to them, oh, my first little girlfriend, we dated for a month, broke up with me. And then they listen to Fall Out Boy and they spiral and it's the worst because they have no sense of when things end or how it gets better or anything like that. So too, like teenager heartbreak and Fall Out Boy, is it with a first-time mother and all that goes into caring for the newborn. And we should probably make another video about things that make having the newborn harder versus easier. But from our position, right, we talk a lot about being classic and family, and we are making moves towards fulfilling even more of that, like moving to Florida and being near family there. But it definitely was harder and still is more difficult that we're not around a deep-rooted community of family or other people where all the kids are around and your mom or my mom can help, or even your sister, and things along those lines. And it definitely would make the newborn stage easier. So
we have lots of thoughts on that, and I think what we'll do.
Don't be a nuclear family, be an extended family.
Exactly.
Which you did do a podcast on.
I did on my Substack. Shameless plug. I think what we want to do next is do a video about answering your guys' questions about the 4th trimester.
Yeah, that'd be great.
I think that'd be fun. And,
if I don't say so myself.
And I think that we should wrap it up here so I can feed this little boy.
Yes.
He's been very patient and he's now asleep, but he should not be. He should be eating. So
Abby is very fastidious about his amount of sleep and his feeding schedule and everything like that. And it's not from some hyper-focused in fake sense of optimizing the baby so that it's nutrient. No, it's if you want to have a better time with your child sleeping consistently and through the night and like not fussing up to like a 10, here, I'm on the screen now, up to a 10, then you got to put in that prep work to like manage his sleep, manage his feedings and the timing so that, your effort is only ever like a 4 consistently versus like, oh, I won't worry about it now, oh, it's a 0, and then I have to experience a 10 frequently. So like,
we're really, really blessed.
Rock
He's a good
4.
sleeper. He's a good sleeper, but also we've put in a lot of effort. And he's already pretty much sleeping through the night, which is really amazing.
And has been for a little bit of time. And so it's like, and a moment's pain for a lifetime's gain, again, comes up in terms of like, deal with that prep work and that leg work of like scheduling and things like that so that you can profit from, the baby can stay down for this time. That's a very big thing. It's not for some fake, unprovable reason of like optimized health. No, it's real results. This is science, people.
So thank you guys so much for watching our birth stories / also our thoughts about parenting and the Copa birth review. I hope you guys enjoyed it. Thank you guys so much for watching. If you're not already subscribed to my channel, make sure to do so and hit that notification bell. I would love if you would consider subscribing to my Substack newsletter, where you'll get access to a ton of exclusive content, including my book club, my podcast, and weekly articles. And if you'd like to follow me on social media, it's at Classically Abby absolutely everywhere. If you'd like to follow my husband on Twitter, it's at Roth the Patriot. Thank you guys so much for watching, and I'll see you guys in my next one. Bye!